I used to say I want to be that person with the 6-pack abs at 80 years old and doing pull-ups on the beach.
Hello, everyone. My name is Zach Shemicki, and welcome to another podcast of the Barbell Effect. I'm here with Gavin Geltz and Katie Homerin, but today we're going to be doing an interview with Gavin. So starting off, tell us a little bit about yourself and what kind of got you into the whole health, wellness, fitness, physical activity kind of field that we're all in.
Dang, man, you hit every side of the circle there. So yeah, like Zach said, my name is Gavin. I'm trying to think. I've been in sports my entire life. I started off, my parents kind of just expected it of me. Not saying that's a bad thing at all, but when I was little, started playing soccer. I wasn't very good at it. Didn't really know I wasn't good at it until you get into that bit more competitive age, later grade school. So around 5th grade was my last year playing soccer, and that's when football first started. It was tackle football at the time. It was available at 5th and 6th grade, where I grew up, and I didn't want to do it the first year. I think I was just too afraid of being hurt, and I didn't really know a lot about injuries and stuff at the time. Didn't really know what my body was capable of. So I kept playing soccer for a year. And then the year after, my friends kind of convinced me to join football. So that year, 6th grade, joined football, ended up loving it. I know you guys both want to understand this, not ever having played football, but you've experienced it in other sports before. There's nothing like that first tackle that you make. Even, a 6th grade kid. I remember my first game, I ran down on kickoff and I ended up tackling the ball carrier, and you just feel this like rush and chills after that. So after that, I knew I was hooked, and I knew sports and football specifically were for me. I ended up continuing to play football throughout middle school and all of high school. And then actually, when I was a freshman in high school, my older sister, she's 2 years older than me, she was on the cheer team. She ended up wanting me to try out when I was a freshman. And, whenever that was brought into contention, I said, no, there's not a chance in hell you're getting me to come to this cheer practice. But my mom ended up working at the school at the time. She was one of the computer lab ladies at the time. Don't remember what the specific title was. But she was my ride home as a freshman. And she said, there was this bring a guy to cheer practice day at the end of the season. And my mom was like, your sister's been begging you to come to this. Just go down there, make her happy for 15 minutes before we leave. Well, I went down there and I stayed for 2 hours because I loved it. So I ended up joining the cheer team. I was in it for 3 years in high school, then 5 years in college. We'll get more into that later. As far as working out and lifting goes, in middle school, my dad tried to get me to work out every now and again. He had a membership at the Y, which he got for free if he went so many times a month. So he brought me, so I'd give him more swipes so he could go less. And I just ended up doing the workout machines, not really knowing what I was doing, just lift as much as I could for as many reps as I could, and then hop on the treadmill. And then it wasn't until high school when I was playing football and I really wanted to become bigger. I wanted to become stronger. I wanted to look like my dad did back in the day, because he always bragged about how big and strong he was and how much he could bench and squat. So I ended up joining the lifting program in high school before my freshman year. It was called Raider Elite. And I ended up falling in love with lifting at that point. I didn't know anything. I was weak as hell. I was this 6-foot scrawny boy, probably weighed 130 pounds, and I didn't know much. And I kept going. I worked my ass off all summer, ended up playing football all 4 years. And in between, I would always go to this Raider Elite and go work out. And Throughout this, all I wanted was to get bigger, to get stronger, and perform better in football and in cheer. And nothing seemed to want to do that at the time. Now looking back on it, I realized I was probably eating 1,500 calories a day and was starving myself constantly. Ended up going to college. I wanted to go into athletic training. You know, being a football player, I had a decent relationship with my athletic trainer in high school. And my cousin Tracy, she also was an athletic trainer, and she had ended up going to Wisconsin Stevens Point, which she brought me around the area, took me on a tour, showed me everything in the AT room, and kind of explained what athletic trainers do. And I thought that'd be a really fun job, getting to work with athletes all the time. So went to school for athletic training, graduated in 2019 with my bachelor's in athletic training. I was the last class of bachelor's students before they switched the program to a master's program, which it's a master's program everywhere now. I ended up going from Stevens Point down to Moorhead, Kentucky, where I was the athletic trainer for Moorhead State's cheerleading team, softball team, and beach volleyball team. And throughout all of this, you know, I wanted to continue going to the gym because it was during college, it was helping me to perform better in cheer. I was definitely becoming more of an athlete when it came into that. I wanted to get better and better. Social media became a bigger part of my life. So I was seeing all of the different cheerleaders around the country and how incredibly strong and talented they all were. And I wanted to be more like them. Then I ended up graduating, going down to grad school, and I didn't have that sport anymore to not only keep me healthy, but to have something to strive for. So the gym has been that for me. And I got a little bit more into bodybuilding at that point, especially due to you, Zach, because you kind of showed me a little bit more of that side of things that I didn't really know until I went into late college and grad school. But ever since grad school, I graduated in 2021 with my master's in health and wellness promotion. I learned a lot more about the public health side of things, a lot more about industrial health. So a little bit more of how you can incorporate health and wellness in the workplace to make your employees a little bit more healthy, which I felt like paired well with athletic training because I got a big education about athletes and how to keep athletes healthy and strong, especially in the injury prevention and management side of things. But I didn't really get the public health side of things. So my master's really helped me with that. I ended up graduating, and I really wanted to get out of the athletic setting. It was a bit of a grind. I will admit I was never more depressed than I was when I was in that setting because it was such a grind, 60-hour weeks, no stopping. I loved it. I loved my athletes, but it was just too much. So I ended up going into the clinical setting where I'm at currently. And I work at the University of Minnesota at their hospital system, M Health Fairview. I work with the Gopher doctors, the Minnesota Gopher doctors. I room their patients. I do the initial evaluation. I help with determining what the injury is, helping the doc figure out either how to get this person back to their activity, their sport, so on and so forth. I do a lot of casting, bracing, taping, home exercise program, prescription, stuff like that. And then I'm also right now in the process and doing my best to create my own business as well, Motivated Movement LLC. I'm looking for it to be more of a, trying to describe it, injury prevention, diagnosis, rehabilitation of athletic injuries for people who are active. It doesn't need to be an athlete. Anybody who wants to do their activity, whether that activity is just walking or if it's going to the gym or if you are a straight up professional athlete, I'd love to work with you on either your performance and helping you do your job better in your sport or activity, or if you're dealing with any nagging injuries or illnesses, deal with that sport, I love to deal with that and help you get through that and better manage it in the future. Large tangent there about my whole backstory.
All right. So your undergraduate was in athletic training, and then you said the program for athletic trainers switched to a master's degree. Couple questions on that. First, is the master's degree like a requirement to become an athletic trainer now? Kind of how to be a dietitian, next year they're making it, you have to have a master's degree to take the exam to become one. Is it the same kind of thing? And then second, is that why you wanted to pursue a master's degree for that reason? Or was it for just further education, further knowledge? Why'd you go to get your master's, and what made you choose health promotion and wellness for your master's?
Absolutely. So yeah, to answer the first question, yes, now it is a requirement. You have to go through a master's of athletic training to become an athletic trainer. It was up until 2018 that people could accept bachelor's students. So like I said, I was in the last class that was accepted to get their bachelor's in athletic training and then sit for the board's exam. So now people have to go to undergrad in a related field, whether it is pre-athletic training, pre-physical therapy, kinesiology, health and wellness promotion, like you guys did. And then they can apply for a master's program at whatever school offers it. And then they have to be accepted in the program. Now it's a 2-year program. It goes for that full 2 years. The summers are included, I believe, at most places. Whereas mine was a 3-year program and I had the summers off like a regular undergrad program would be. And then to answer the second question, it was my goal after undergrad to work in college athletics. That's what I thought I wanted to do at the time. I didn't want to go to professional athletics because I assumed at that point you would have no life outside of work. Little did I know that the college setting is very similar to that. While I would get summers for the most part, I'd probably get, unless I worked with a spring sport, I'd get June through July off pretty much completely, other than maybe some summer camps to cover. But I realized that in grad school, I, was in the college setting and I was working my ass off from August all the way through May. And I don't think it helped that the pandemic started in the middle of it, but I realized that wasn't the setting for me anymore. But I wanted to get my master's because to work in college athletics, it's kind of the next step after undergrad, at least, when it was an undergraduate degree still, to go to grad school and work as a graduate assistant athletic trainer and get your master's while you work in the setting. And that's kind of an internship. So that was my plan, was to go get the master's degree. And I also didn't want the new grads coming behind me to have a leg up on me in the future for jobs that I wanted. I didn't want Johnny over there with his master's degree in athletic training to get a leg up on me because I have a bachelor's, even though we had the same education. It's just in a different format now. The whole point behind athletic trainers now to be able to have a master's is, as athletic trainers, we've historically been treated poorly in regard to time and money. So the change to the master's is slowly adjusting that. So essentially we can get better benefits, make more, and not get just destroyed with hours like we normally do, which we're in that transition period right now. And it's tough there. Everybody likes to say there's an athletic trainer shortage, but I disagree. There's a shortage of athletic trainers that want to work 60 hours for shitty pay. And that's why I work in the clinic. So, yeah.
Yeah, I totally get that. That's the same exact thing in dietetics and nutrition. Like that's the exact reason that they're making the master's requirement. Like the main reason that is to have more of like an equal playing field among all the different providers in like a hospital setting. But also dietitians are one of the lowest paying fields or jobs in a clinical setting compared to the other providers. So yeah, it's the same exact reason.
Yep.
I have a question. So why, for your master's program, why health and wellness promotion? Oh, yeah. And do you feel like that will like add benefit to when you start your, well, I know you've already kind of started your own business, but like going into your own business, do you feel like having both the undergrad and graduating in athletic training and then the master's in health and wellness promotion will benefit each other?
Yeah. I know Zach touched kind of on that as well. I chose health and wellness promotion because I took the job and then I was offered the different masters that I could go for. For the most part, when people go to GA jobs like that, a lot of times they choose like sports management if they want to in the future become like an athletics director, or even business, which looking back at it now, I don't think I would have minded doing my MBA. I think I would have, I think it would be helpful right now in regard to trying to create my own business. But health and wellness promotion kind of stuck out to me because I wanted to learn more about the body. I wanted to learn more and educate myself more about things that I already knew a little bit about. I wanted to dive deeper into it, and I got to do that. And like I said, I was able to dig a little bit more into the public health side of things, which I think has helped exponentially with my current job, because I don't work with just athletes anymore. I work with the general public, in a sports medicine clinic. So I see John, who's 95 years old and his low back hurts and he hasn't exercised in 25 years. And I understand how life can kind of impact your health now compared to just the athletes who are, they're going to deal with pain because of their sport. Whereas, people who are getting older, they're dealing with pain because they're getting older. And that is a normal part of living your life. And that master's definitely gave me an insight into the general public and what they deal with compared to athletes who are generally on the healthier side. It also helped me branch out from just musculoskeletal injuries. Don't get me wrong, I had a great education, like Zach talked about previously, a holistic education in regard to athletic training. There was a large mental health section of it, but I learned a lot more about the whole person. And like you said, the 7 dimensions of wellness, compared to, like I said, just the athlete dealing with their sport and the stressors of that and things they need to pay attention to. So I felt like it was very beneficial in that regard for me.
Kind of talking about working with the general public and the general population, and not athletes, but like even just older people or even middle-aged people, and just in general. Is there in athletic training, is there a lot of like misinformation and like misconceptions about stuff? And like, do doctors tell the patients things that aren't really correct that you have to then go in and be like, hey, forget that? Because there's a lot of that in nutrition. Yep. Where there's all those different fads and like supplements and everything. There's a whole list of nutrition, but then even with the providers, there's a lot of times where, say, someone will come in and we're referred for diabetes education. The first thing they say is, oh, the doctor said I can't eat this, I can't eat this, I can't eat this, I can't eat that. I can't eat anything. So like, what am I supposed to do? And then we have to be like, pretty much forget everything they told you and start over. Is there a lot of that in athletic training?
There absolutely is, especially in my setting, because I work, like I said, one-on-one with a doctor. So I go in, I do the evaluation, I tell the doctor what I think is wrong. The doctor goes in, they do an evaluation, and then they kind of tell them what they need. And I go facilitate that, whether it be, hey, this person hurt their knee, they need an MRI. Hey, we're going to do a cortisone injection for this person. Go draw that up and get it ready for me. Hey, this person needs a home exercise program. I need you to make that for me. So a lot of times what I've noticed is that the rehabilitation realm, which I am very passionate in, it's one thing that I love. And when it comes to the gym, I love using the gym as rehabilitation for people, because working with the average person now, the average person does not go to the gym, does not exercise at all. So I can use just general exercise as rehabilitation for a lot of people. And most exercises that I give them are gym exercises, which is great. So when it comes to things the doctors say that I don't necessarily agree with all the time, I got to be kind of careful when I talk about this. It's a lot about, for me, specific exercises that they're told not to do, or ways of doing these exercises that they're not to do. Just like that, your docs tell your patients, hey, don't eat this food. My docs will say, hey, do not do this exercise. This hurts. Or the patient will say, oh, it hurts when I squat down this far. And the doc will say, well, don't squat down that far. There's a lot of memes made about that, but it honestly is true. And so I have to kind of put out some fires sometimes in that regard, meaning, it's so much more complex than just don't do this movement. There are ways to mitigate pain while you're in the gym, and also pain education in general. Something I have learned a lot about since graduating, and have been dealing with these patients who are a lot of times in chronic pain that nothing has helped, is pain is so much more than a physiological response. It's psychological, it's emotional, it can be physiological. Break a bone, you feel pain. Well, if you think about it, there are a lot of experiments out there. I'm trying to think. The phantom hand one is one that comes to mind right away, which, Zach, I'm sure you've seen before. I don't know if you have, Katie. It's where you take a guy or a girl, and you have them sit with a divider right next to them. You put their hand on the outside of the divider so they can't see it, and then you put a glove with their long sleeve going into the glove, and then so they only see the fake hand in front of them, and then you give them a stimulus on their actual hand that they can't see, and then the glove. So like a brushing, you take a brush, you go over it, and then after a while you take a hammer and you start lightly tapping on the hand that's not real, and then you ended up hitting it. I know it's more complicated than that. Nobody call me out on this. This is just a general gist of it. People will feel pain from the fake hand. They'll actually get sensations from the fake hand. So seeing that is a psychological response to fearing pain. And I have to say that a lot to people, like, okay, just because you feel pain doesn't mean damage is happening right now. You can feel pain because you are afraid of that, whatever is happening right now, and your body is telling you, hey, maybe we shouldn't do that right now. And this is a topic I can get much more into deeper and later in the podcast, but I have to talk about that a lot with people. And I feel like, especially due to timing, the docs don't really get to go through that, because our appointments are 20 minutes. So I get to go in there after the doc's done and be like, okay, what fires do I have to put out? And that's one of the things.
Okay, yeah, that's cool. That's the same exact thing here, where we just have a short time to go over it.
Mm-hmm.
But yeah, that's an interesting thing to think about too, is how it, like, pain can be psychological too. When you're explaining that made me just realize like a personal thing I've been noticed. I have some like hip pain and discomfort, and in my shoulder, kind of by my shoulder blade. And I found that the more I think about it, the worse it gets. And that if I just take a moment and just fully relax, like, it almost completely goes away. So that it's like weird but interesting at the same time. And I think that can kind of muddy like people's perceptions of like what can make it get better, and like how they can improve it, if their mind is a big factor in making it worse or better.
Yep. And that is a big thing that I talk to people about when I see them, especially before I talk to the doctor. And when I'm doing my evaluation, I ask them, how is your mental health? How are you doing as a person outside of what you're coming in for? Because I think we can all think of a time in college, Zach, right now with your studies, or a time that we've been stressed where everything just hurts just a little bit more, whether me personally, and this is completely anecdotal, but I develop really bad trap spasms when I'm stressed and when I'm working a lot. And I just end up hiking my shoulders and the muscles spasm up, and that causes pain and that causes spasm. And we're stuck in this cycle. And I find that it's because I'm super stressed and I'm more, I won't even say depressed necessarily, but when I've been depressed, I've been more in more pain. And so that is a huge side of things where it's like, okay, this person's coming in for, say, like a trap spasm like that, and it came out of nowhere. Okay, are you in school right now? Say it's a college kid. Yeah, it's finals time. You're stressed, dude.
Yeah.
I almost guarantee you, if there's no injury and you are feeling that type of pain, it's because of an emotional response or a psychological response. And that's where it comes back to the 7 dimensions of wellness, where it's not just broken tissue causes pain. There are so many different things that cause it. And, that's why people go to the doctor, is they want to figure out what's causing it. Not everybody likes it when I tell them something's not broken, and that's why it's causing their pain, especially older folks when they've been around the block a few times. But that's just part of the game. And sometimes you got to tell people what they don't want to hear.
Yeah. I have that exact thing going on. Like my traps and sternocleidomastoid muscle are constantly tight, and I'm constantly having to like it feels like I have to like physically like flex it to make that discomfort go away. And a big portion of that, of like the past couple of years, have been like, it's progressively been getting worse. And I've realized that it's just been like a mental thing, stress. And like I was able to kind of separate it. And I know it'll probably get a better or easier to manage once I'm done with school now.
Yep. Whereas, if you talk to said Instagram influencer, they'd probably tell you it's all about your posture, or it's all about, whatever else that you're doing. Whereas it's always multifactorial. There's always 2 or multiple sides to every single injury that I see or condition that I see. Just like with you and your job, and Katie, with your clients that you deal with. I mean, we all know that there are so many different issues that go into one person, and you need to hit it from multiple different angles in order for people to best mitigate their symptoms or whatever they're dealing with.
Does Katie want to pop in?
I'll pop in. No, it seriously makes total sense. Just like, I mean, I had surgery on my knee over 6 years ago, and still to this day, 1 week I'll feel fine going in, doing my lunges, and then the next week I'm like, man, that knee is really bothering me. But it's not like re-injured. It's just having a day. Like we all have a day sometimes. So can these things, but also everything is connected. Like I think a lot of people think, oh, if I'm feeling pain in this exact spot, then this exact thing is what's wrong or what's hurting or what might be hurt. But in reality, everything is connected, and it could be something completely different than what you think is happening. So I totally agree. But what do you feel like that is like one of the hardest parts about like your specific job, is just like relaying, I guess both of you, like, is kind of trying to like relay that information as best as you can when like you cannot control everyone or everything giving information?
Yeah, it is especially hard for me in my role. I'm not the physician who this person is signing up to go see. Like they are paying money to see the physician, and I am doing what I can on behalf of the physician to help them so they don't waste their money and they get the best care that they can. So I do have to tread lightly when it comes to the things that the physicians say, even when I don't necessarily agree with them. And don't get me wrong, I'm not saying that I know everything by any means. Like there is a reason they are a doctor and I am not. They view things in a holistic approach as well. I will say that out of all of the doctors I work with, I know what doctors are going to say what specific things about what specific people. And sometimes they frankly just want you out of the room and they want you to leave so they can go home. And don't get me wrong, we all feel like that sometimes with some people, and that's okay. some people don't want to be helped. They just want to complain to somebody for a little bit, and they will pay the money to do that. They're, you'll tell them, hey, this is what you need to do if you want this to start getting better. And they'll say, screw you, I'm going to go do what I was going to do anyway. Which, makes a lot of sense if you're paying a crap ton of money to go to the doctor. But I do find that is a difficult thing to do, because you're breaking, how do I say this, like molds in people's heads that they've been, or thought trains that they've had for years and decades. They're like, especially with the pain one, it's like, this hurts, that means there's something wrong with this tissue, just like you said. And you deal with that with spine related issues a lot, because you can have what's called radicular symptoms, where you have, say, like a pinched nerve in your neck or in your lower back, and that causes pain that shoots down your leg or your arm, what we generally call sciatica. People sometimes really struggle with that, because they're like, I'm feeling pain in my foot right now, and you're telling me the issue is my back. And they don't want to hear that. They have a preconceived notion of what their pain is, and they think they know what their pain is. And trying to break those barriers and break those trains of thought can be very difficult depending on the patient. Some people are great. Some people are super hard to deal with when it comes to stuff like that. And in my specific realm, telling people to exercise with one, arthritis, is a big challenge, because a lot of times the people that we see don't exercise a lot. So telling them to go exercise, they're like, well, I can't even stand up from a chair without this hurting. Why do you want me to go exercise? That's just going to hurt it more. Well, there's a plethora of research out there that says weight training specifically is awesome for osteoarthritis. And I have to go through that with them. And a lot of times people don't believe me, and it's just how it goes, and that's okay. But I've helped a lot of people in that regard. And I'm very happy about that. And I've gotten a lot of people to go start working out, and even if it's small things. And I've gotten people who are elderly to go start lifting a weight, lifting weights. And it's something that I pride myself in, for sure, because I see a lot of people who are getting older now, as we're, nearing our 30s, and I see the condition that they're in, and it frankly just makes me sad that they didn't take care of themselves a little bit more. So my passion is getting people to work out and understand pain a little bit more, so they can live a longer, more prosperous life and do the things that they love until they're, end up dying. And I want to be that person. I used to say I want to be that person with the 6-pack abs at 80 years old and doing pull-ups on the beach. I don't need to be that, but I definitely want to still be lifting. I want to deadlift when I'm, 80, 90 years old, if I make it that far. So I think my passion is getting other people to do the same, and to be able to live the life that they want to as they get older, because every day I see people who don't get to do that, and it makes me sad. So that's what I strive to do, and I will strive to continue to do with my clients and future clients that I see from my business. And if I'm still in the clinical setting, I'll do my best to do that as well there.
Yeah, I've noticed the same kind of issue with talking to people after they either talk to the provider or stuff that they've looked up on their own. First, I think people have this like preconceived idea that the doctor knows everything, and what they say has to be right because they're the doctor. But I mean, that's why we have our own specialties, because we are the experts in that regard, and we work with the doctor. So like the doctor with athletic training, the doctor probably has some education in like physiological issues and skeletal muscular and like joint issues and everything, but it's probably been a very small portion of everything that they've learned. And it's the same thing with nutrition. They probably only have like maybe 1 or 2 classes in their whole schooling program, whereas the dietitians, that's literally the only thing that they went to school for multiple years. So it's the same kind of thing where people want to listen to the doctor over what you have to say because it's the doctor. So you definitely have that problem when you're trying to educate someone, but then you also have some people who are like, oh, you're the dietitian, or oh, you're the athletic trainer. Like, I want to listen to you and what you have to say, and I want to learn and figure out what's actually going on. So like those specific things you were talking about with like the specific exercises or arthritis and everything, it's the same kind of thing as with nutrition too. People talking about like pesticide use or different things, or like organic foods, and or you need to eat only fresh foods and you can't have anything that's processed, when in reality nearly every single food in the grocery store is processed. Even the like the raw meats you get at the butcher area, those are processed. They underwent processing. That's what cutting the meat is, and getting it off the animal is. It's processing. So I think there's just a lot of, it goes back to what people have seen or read or looked up on their own, or what they hear from someone who they believe to be the expert in everything. It kind of just depends on the person how easy it is.
Absolutely. And for my doctors, in their defense, especially because I respect the hell out of the physicians that I work with, they go through it depends on if they're MDs or DOs. Their education is a little bit different on musculoskeletal issues. DOs, they start with musculoskeletal issues and then work out through the whole body from there, is what I've been told. MDs have a smaller portion, and I've had to educate a lot of our residents about specific issues before, and that's been a fun time for me to be able to talk to them about specific musculoskeletal issues, and educate them on things like that, because their education wasn't that great. I will say to be a sports medicine, to be certified to work as a sports medicine physician, I don't know the specific terminology with it, so I apologize if there's any docs listening. They have to go through a fellowship, which is a year-long fellowship, working with a sports medicine doctor one-on-one every single day. So they see a lot of these issues. It's what I noticed the big issue with is the rehabilitation side of things and the exercise application side of things, because they don't see that generally. I don't know of any programs for docs where they go and see, or they go and shadow physical therapists or the rehab side of things really at all. So that's one side that I could definitely see them lacking in a little bit more than others. That I'm hitting on more specifically. I like to cover my own ass if I have to.
For sure. And I think that's honestly, that's a good thing, like, that I've been coming to see too, is if you are working with a doctor and you see them recommending something or saying something, to kind of bring it up with them and talk with them. I kind of struggle with this personally, just because like I don't work there and I don't know the doctor as like a full-time position. Like, I'm there like 2 days a week for a few weeks at a time. So like I don't really know the doctors by names, and it's like that personal preconceived notion, like that's the doctor, like they're the the head person of the entire care team. So it's like, what do they want to hear what I have to say? But it's like important for us, because that's our job. Like our job is our specialty. Like with me, nutrition, you in athletic training, like if we notice something that they are saying is off, like it's important for us to then talk with them about it. And of course, like being respectful and doing it in a productive way, because they definitely are great providers and they are awesome at what they do. Absolutely. But we still want to, even though they still don't know everything, just like us.
It's been nice. I've had some of our docs, they have their own issues. They're people too. And I know a couple of them who have injured themselves, and they're going, hey, can you write me a program, please? This thing's killing me. I got an MRI. It didn't show anything. I just need physical therapy, but I don't want to go. Can you write me a program? I'm like, yes, I can write you a program.
So yeah, we're getting kind of up there with time. So to kind of wrap it up and close it up, so where do you want to go with your like career, your job, your business? And then same thing with this podcast.
So obviously, like I said, I'm in the clinic right now. It's definitely not what I want to do forever. I miss like being one-on-one with the rehabilitation side of things. That was something I loved while I was in grad school, while I was working one-on-one with athletes every day, because I was the person that they went to for all of their musculoskeletal issues. And if I felt like they needed further to be seen further, I sent them to the doc for whatever testing and imaging that they needed, and so on and so forth. So I don't get to do a lot of the rehabilitation side right now. It's pretty much just education and home exercise prescription when I see these patients. But the patients can come one time, or they can come a few times, but doesn't necessarily mean I'm working with the same doctor. So it's hard to get congruency with care, because they might have a different athletic trainer that day who might treat things just a little bit differently than I do. So it's definitely not what I want to do forever. Right now, it's what's best for Katie and I to stay in this position. That is why I started Motivated Movement. I would love to start seeing people online. I haven't fully worked out the kinks of it yet, but I'd love to be able to do online evaluations and then home exercise prescription, and then be able to follow up with people on how things work and progress them from there, with whatever condition they're dealing with, even if it's just performance. Or if they're dealing with a specific injury or condition that's causing them pain. That's what I would love to do. And eventually down the road, I would love to have my own facility that's got a nice big turf floor and a bunch of racks and all the exercise equipment that you could want, so I can do rehabilitation with people. Because like I said, I love using the gym as a rehabilitation tool. My favorite exercise, or my favorite rehab exercise for the legs, is just doing a squat and getting people to do a squat in the most efficient way they can, and just get people to exercise in general. Because like I said before, most people do not get the exercise in that they need to. Even athletes, they exercise what they are told to do and what they do in their sport, but a lot of times there are things that are lagging for them. And I'd love to be able to work with them one-on-one to be able to help improve them so they can better perform at their sport, or, deal with whatever injury that they're dealing with. So, yeah, I used to love bringing people into the weight room when I was in grad school just for rehab. And a lot of people didn't get it, because in most PT clinics, there's not a weight heavier than 20 pounds in there. And I'm like, no, let's get these people loading their tissues. Let's get people stronger. And the best way to do that is in the gym. So that's the end goal. And I hope this podcast can help me. I'm relatively new to the social media side of things, posting content. And like you guys said, this is a better form of, how'd you call it? Long form content. Yeah. So you can see I'm a content virgin right now. I think it would be a good way to get myself out there. And I have always loved conversations with both of you. And I feel we have good banter back and forth. And we also have our own specific niches that very much complement each other, and we can become a valuable tool for a lot of people. So I think this could be very good for all three of us and all of our individual businesses. And it all comes down to, I just want to help people. I want to help people do what they can throughout their life, because life's short and you might as well be able to lift some heavy shit throughout the whole time.
What's your favorite color?
So unlike you two, my favorite color is not black. I like black. It's a great color. It goes well with anything. My favorite color is like a cobalt blue. It's like a deep blue. If you're curious what that is, look at any blue lightsaber in Star Wars. Yes, I'm a nerd.
I know what you mean, like the electric blue,
Yeah.
like dark electric. Yeah, I like that too. As always, thank you so much for tuning in with us. For more free content and to stay in touch, be sure to give us a follow. You can find us on Instagram and TikTok, homerun_fit for Katie, Gavin_Geltz for Gavin, and Z_Chomicki for Zach.
Also, feel free to email us with any questions or topics you'd like to hear on the pod at thebarbelleffectpod@gmail.com. We'll be sure to link all of this in the show notes for you as well.
Lastly, if you like this episode, please leave a rating and review so others who can benefit from what we offer can find us. Until next week, keep moving, don't eat like an asshole, and fucking stay hydrated.